Welcome to the Neonatal Intensive Care Unit at CHKD. This brief video is meant to give you an introduction to our NICU. We're sure that you'll still have many questions, so please don't hesitate to ask them. You can find this information in your NICU 101 binder, which will be provided by your social worker. Additionally, most of this information can be found on the CHKD website under the NICU portion at www.chkd.org. The CHKD NICU is a level 4 NICU with 70 beds. Most of our beds are in private rooms, while some will be in semi-private rooms. The rooms are further divided into 6 color-coded pods. The pods are divided between 2 medical teams. One team consists of neonatologists and residents, while the other will be neonatologists and neonatal nurse practitioners. There are many other professionals here to support you during your NICU stay. Some examples are bedside nurses, respiratory therapists, occupational therapists, physical therapists, speech-language pathologists, registered dietitians, pharmacists, lactation consultants, social workers, case managers, and many more. The CHKD NICU is equipped with a parent lounge to help support you during your time in the NICU. The parent lounge has a refrigerator, microwave, coffee machine, water and ice dispenser, computers with internet, and plenty of seating. The parent lounge is also where classes are held, as well as the support group held twice a month called Dine and Discover. Families will earn NICU bucks for attending classes, as well as achieving developmental milestones in the NICU. NICU bucks can then be used in the NICU store to buy things like clothes, books, and toys. Infection control is very important in the NICU because our patients are at extremely high risk for infection. Currently, visitation is limited to 2 caregivers and 4 additional visitors who are over the age of 18. The 4 visitors chosen cannot be changed during your baby's stay in the NICU. Please let your nurse know as soon as possible who you would like to have added to the list to avoid any delays in visitation. Caregivers are also given a passcode that they can use to call and get updates on their baby at any time. This passcode should not be shared with other people and should only be used by the 2 caregivers who are listed for the baby. You can visit the NICU at any time, but we do ask that you limit calls and arrivals during our shift change. This occurs between 6:30 a.m. and 7:30 a.m. and 6:30 p.m. and 7:30 p.m. Another way that we protect our babies from infection is by asking you to place your cell phone in a small Ziploc bag when you arrive to the NICU. Did you know that cell phones have more bacteria than a toilet? It's true. So we do ask that you keep your cell phones in these Ziploc bags throughout your entire visit to the NICU. Additionally, you should be washing your hands when you first arrive at the pod where your baby is staying for a 3-minute scrub from your fingers to your elbow. All jewelry will need to be removed from the elbow down before you do this hand washing. After you've washed thoroughly for 3 minutes, you should dry your hands and apply the surgical scrub, which is located by the sink. This procedure only needs to be done once upon arriving, but you should be washing your hands with hand sanitizer or soap in between touching any surfaces and touching your baby again. This is especially true after diaper changes. Hand washing is the #1 way that we can protect our babies from infection. In the NICU, we have what's called hands-on or care times. This is when we do our assessments and feeds. Most babies will have hands-on every 3 hours, every 4 hours, or every 6 hours. Parents are always encouraged to participate in hands-on, so please ask your nurse when your baby's hands-on times are, and if you plan on being present. One way that parents can bond with their babies in the NICU is by doing skin to skin. Skin to skin has many benefits for babies as well. Babies who are held skin to skin have improved heart rates, respiration rates, temperatures, sleep cycles, and brain development. Skin to skin is done by holding your baby's bare chest to your bare chest for a minimum of 1 hour. Babies can be held skin to skin anytime they're stable enough to do so. A great time to do skin to skin is when your baby's having their isolette changed. The first isolette change will be at 7 days. You will receive an invitation with dates for your baby's first isolette change so that you can plan to be there. You may be wondering when your baby can start eating. It will depend on the patient, but most babies in the NICU will start feeds through a tube that goes into their nose or mouth and directly into their stomachs. Before feeds are started, babies can have what's called oral care. Oral care is done by placing a small amount of mom's expressed milk into the baby's mouth using a small syringe. Oral care helps babies stimulate their immune systems as well as their digestive systems. Breast pumps are available at the bedside, and families are encouraged to use them whenever they need to. Additionally, lactation consultants can come to the bedside for consults. Please let your nurse know if you need a consult with a lactation consultant. We know that coming to the NICU can be an overwhelming and stressful experience. We hope that this video has helped answer some of the questions you may be having. There's lots to learn, but don't worry, you can ask us for help anytime that you need it. We're here to support you.